Okay, hello to everybody, my name is Dmytryi Skoryi and today I'm going to tell you about the clinical case which was prepared with the help of the Department of Internal Medicine number 3. This clinical case highlights the problem of pericardial effusion with a possible risk of cardiac tamponade development. And at first we should start about giving some anatomic considerations of this problem. So what is pericardial cavity? It is a special cavity which is located between the parietal and visceral layers of pericardium, and in a normal physiological condition it contains up to 50 milliliters of fluid. The volume of pericardial cavity can be increased with the help of two sinuses, a transverse and oblique sinuses. But in some situations, even this extra volume can be not enough in order to keep a necessary level of intrapericardial pressure. In situations when the accumulation of fluid inside of the pericardial cavity happens during a short period of time, an acute condition can be developed. It can be provoked even with a small amounts of fluid. Small amounts are for about from 100 up to 200 of milliliters. You can see it here at this slide. On the other hand, when the accumulation of fluid happens during a long period of time, only large amounts of fluid can provoke a significant increase of the intrapericardial pressure. And this relation is called PVR, or pressure volume relation. And when it is higher, then it is more possible that cardiac tamponade can take place. Here you can see the most common risk factors for cardiac tamponade. They can be divided into two categories, infectious and non-infectious. The list of them you can see at this slide. On the next slide you can see signs and symptoms of cardiac tamponade. The most important of them are sinus tachycardia, hypertension and pulsus paradoxus. And now we are going to describe the clinical case as itself. So a 57-year-old man was delivered to the cardiology department of Kharkiv Regional Hospital after 16 days of treatment at the place of residence. He had a progressive shortness of breath at rest and exertion, chest fullness associated with dry cough, oral weakness and swelling of the legs. And it was previously known that he had a pericardial effusion, but the genesis of the pericardial effusion was not known. So there were several main tasks for the cardiology department. The first one was to reduce the progression of pericardial effusion and to prevent the possible risk of cardiac tamponade development. In order to do that, the procedure of pericardial synthesis was used. The second task was to find out the reasons of the pericardial effusion, why it happened. And the last task was to stabilize the hemodynamic condition of the patient. So, here at this slide you can see an image of pericardial synthesis when the subxiphoid approach is used. And at this slide you can see an image of a patient before a pericardial synthesis. So it was performed with echocardiographic guidance and under an ECG and blood pressure control. Here at this slide you can see the procedure of pericardial synthesis in process and the character of fluid which was effused from the pericardial cavity was hemorrhagic. So it was a hemorrhagic fluid inside of the pericardial cavity. And it was effused 850 milliliters of hemorrhagic fluid. Here, at this slide, you can see a specific sign of pericardial effusion which happens during a long period of time, so when it is chronic. It's a swimming heart. The heart is swimming inside of the pericardial cavity because it has a large amounts of fluid inside of it. And on the next slide you can see the procedure of pericardial synthesis under the echocardiographic control. And here you can see the needle, and such a specific symptom as swimming heart was reduced. The next question was to find out what was the reasons for the pericardial effusion. And according to the computer tomography, there were found the specific signs of left lung central bronchocarcinoma in the lower lobe of left lung. So this assumption later was confirmed by the cytological examination, which showed us the signs of malignization process. And after an oncologist consultation, it was revealed that patient had a malignancy process, and the character of those bronchogenic carcinoma was T4 and 2M1. You can see it here. And at this slide, you can see the data which were obtained with the help of the computer tomography at the speed of 15 frames per second. And here you can see the signs of the central bronchocarcinoma of left lung. And at this slide you can see two X-ray images which were taken before and after the performance of the procedure of pericardial synthesis. And in conclusion, we should say that our clinical case highlights the problem of pericardial effusion with a possible risk of cardiac tamponade development, and when it has a neoplastic etiology. And it is very important to say that patient said that he was feeling much better even after deleting a 50 milliliters from the pericardial cavity. And and by the end of treatment, patient was referred from Kharkiv Regional Hospital to the place of residence for performing a symptomatic treatment. That's all. Thank you for your attention.